Alcohol is one of the common reasons why patients have liver disease. Fortunately, within the last few years, we have made significant progress in the testing for alcohol and its metabolites in the body. Previously, the only test available was a blood alcohol level. That only stays in the blood for a few hours, depending on how much you drink. But these days, we have multiple other tests available that can detect alcohol in your body for as long as a couple of months, depending on how much you're drinking. So, to name a few tests, depending on what physician you see, they may order different combination of tests. In our transplant center, we specifically use a test called phosphatidyl ethanol. This is a product that when the alcohol is broken down by your body, it gets converted into the PET. And this gets into your red blood cell membrane, which is your red blood cells. And it stays in the red blood cell membrane for the life of the blood cell. So it can be detected for as long as you have those blood cells in your body. And that's why we can detect alcohol for up to 2 months or maybe even longer if you were a heavy drinker with these specific blood tests. These have been the best test for most transplant centers just because of how long we can detect the alcohol level. And as I said, the blood alcohol only lasts in your body for a few hours. If they do other tests called ethyl sulfate or ethyl glyceride, they only stay in the body for 2 to 3 days. And with the PET test, it could be 2 to 3 weeks to 2 to 3 months, depending on how much you drink. All patients who get worked up for transplant are checked for alcohol in their blood, and they're checked for alcohol in their blood while they're on the transplant wait list. And if at any point the alcohol testing comes back positive, they're not considered for transplant anymore and they can be taken off the transplant list. We also monitor patients with history of alcohol use after transplant on a regular basis to make sure they're not going back to drinking after the liver transplant.